excited by that introduction because I also experienced severe perinatal mental health problems myself and used some wonderful specialist services. So that's really shares your passion for rolling out these services and to making sure they're available to women in all parts of England and indeed across the UK. So I'm a project manager on the Perinatal Mental Health Transformation Programme at NHS England, and this is one part of the 5-year forward view delivery. We're a very small team in perinatal mental health, and we work with 2 associate national clinical directors, Dr Jo Black, who runs a specialist perinatal community team in Devon, and Dr Giles Beresford, who's the consultant psychiatrist on the mother and baby unit in Birmingham. So I think I'm sure you've already seen this slide today from Tim this morning, showing that the perinatal mental health objective is one of the many objectives of the forward view, and our particular focus is on ensuring that at least 30,000 more women each year can access evidence-based specialist perinatal mental health care. And that figure was derived from looking at the best data we could access at the time on the number of women currently accessing specialist perinatal service compared to the expected prevalence of mental health problems during this period. And just for anyone that's not familiar with the term, when we talk about the perinatal period, we refer to women during pregnancy and the first year after childbirth. So we've had a great lead-in already to the Centre for Mental Health and London School of Economics report, which was the background to this investment in perinatal mental health, around the costs of untreated perinatal mental health problems to society. And it also aligns with what Sue was talking about, because a lot of these costs are about the impact on the child and the adverse outcomes for the child in the future. So in terms of prevalence, up to 20% of women develop a mental health problem during pregnancy or within a year of giving birth. And what's a really stark reality is that suicide is still the leading cause of death for women during pregnancy and the year after giving birth. So that really emphasises that the high risk that's surrounding this period and the importance of addressing these needs. And I think kind of the study that was done was led by an organisation called the Maternal Mental Health Alliance, and again, that was a campaigning organisation bringing together many organisations that cared about this agenda, and it was really driven by the voice of women with lived experience and passionate clinicians. And before the programme started, there were fewer than 15% of localities across the UK provided specialist service with women with complex severe conditions at the level that was recommended, and more than 40% of areas provided no service at all. So this campaigning and these, the stark reality of these figures led to investment to develop improved services, and there was a total 365 million being invested across the 5-year forward view period. And you can see here that investment is spread on the 5 years across community teams, additional specialist funding over the next couple of years to develop further evidence-based guidance and other services, mother and baby units, which are inpatient units where mums can be admitted with their babies in times of acute mental illness, workforce development to support this investment, and you've heard, I know, from others today about the importance of workforce development to support the delivery of these objectives, and also the investment in clinical networks in all regions across England to strategically support the developments. And because it takes a while to really build the capacity and capability in services and put the frameworks in place for services, you can see that the number of additional women to be seen each year grows across the course of the programme, with the target of 30,000 additional women for the final year, and then ongoing after that with sustained investment. So the way that improved community services have been delivered to date has been through something we've called the Community Services Development Fund. So in the fund, it's been rolled out in 2 waves. So in wave 1, there was 40 million available to areas to bid for through a competitive bidding process for areas that felt it was pump prime investment for areas that felt ready to develop local specialist community teams at a fast pace at that early stage. So the funding was allocated to 20 areas across England, as you can see on the map. The services and the areas varied in size. Some of these areas already provided a small specialist service. Others had no service at all, but the areas selected were the ones that had already done a lot of strategic planning, had local champions, had plans in place across their areas and were ready to provide safe, sustainable services at that early stage of this investment. And across those areas, by the end of 2017-18, they'd recruited 236 new specialist staff to these teams. And the teams consist of consultant perinatal psychiatrists, psychologists, mental health nurses, occupational therapists, nursery nurses, peer support workers, some specialist pharmacists, specialist social workers, and there is clear kinds of guidance in place around the multidisciplinary teams that are needed to provide comprehensive care. So by the end of 17-18, the target had been for 2,000 additional women to be able to access these services, but by the end of that year, over 7,000 additional women were seen in those services and received evidence-based interventions, which is really testament to the hard work and passion of the clinicians, commissioners, and also the patient leaders in those areas, because what's been really exciting about these services is the levels of co-production involved at every stage of development. So the Maternal Mental Health Alliance produced the map, as you saw earlier, and then in 2017 they repeated that map following that investment, and you can see for England the map is really turning green. For the other devolved nations, they're also starting to invest in this area, so over time we'll see the map turn greener for the whole of the UK. And just on that map you can see some areas kind of have rated themselves a worse level than they were when the initial survey was done, and that's really because of their increased awareness of what a high quality service is, and more awareness that actually what they had should still be better, and it wasn't as comprehensive as they first thought at the first assessment. So in wave 2 of the fund, we've invested an additional 23.5 million this year. Again, it was a competitive bidding process. STP led this time, but across by the end of that, basically every STP area across England had applied for funding in either wave 1 or 2. And by the end of this year, it means we'll have been able to fund every single area across England to provide a specialist perinatal community team. That's not the end of the story, because some of them have still only got funding to start a smaller team, not necessarily the full multidisciplinary mix, or not necessarily to see like everybody in their area that would need that service. So over the next 2 years, the levels of funding going into CCG baselines will increase, and some of those services will still have further expansion to do. So local lobbying still needed, local kind of evidence still needs to be gathered of effectiveness to ensure that commissioners continue to invest in and expand those services. So the other key area of investment has been in mother and baby units. At the start of the programme, there were 15 mother and baby units in operation across England with varying numbers of beds. And women were often travelling very long distance to be able to access these units to receive treatment where they could stay with their baby and have their relationship with their baby supported whilst they recovered. But many women, because it was too far away and wasn't practical or feasible within family circumstances, chose not to access mother and baby units, therefore having to be admitted to local acute wards and separated from their baby. So this was a really key area of development. And so today, 8 additional beds have been commissioned in existing units, and 4 new 8-bedded units are opening up during this year. So in Devon, a 4-bed interim unit has already opened, and they've got a whole new build going on to open in March 19. Kent and Medway Partnership Trust, who is actually my own Trust that I was seconded from have just had the formal opening of their new mother and baby unit this week, and I hear it's an absolutely marvellous environment. Our programme lead said it was the best ward she'd ever visited anywhere, so I'm looking forward to getting a chance to go. And then you can see across other areas of the country over the next few months there'll be other additional units. And there's also investments being made in the existing mother and baby units to ensure quality improvement and support equity of delivery across those units across the country. So just a word about clinical networks, which have also been funded. So 12 multidisciplinary perinatal mental health networks are now in operation across all 4 regions of England, and each of those has clinical leadership from either a perinatal psychiatrist, psychologist or specialist perinatal mental health nurse. And these networks are funded to bring together clinicians and managers, commissioners, experts with lived experience, third sector organisations and local authority. Really all services that see women were during the perinatal period really, and women who have potential to develop mental health problems during that period. And I guess unlike a lot of other mental health services, there's really close partnership working with maternity colleagues in particular and health visitors, which I guess in a lot of other kind of secondary mental health services that working isn't so close. So, and the services in place support services across the whole pathway. So whilst they see women at the acute end with more moderate to severe problems, they provide training and support to their colleagues around them in all of these other services. So the networks have been identifying their local needs for services and training and developing local care pathways. And they've engaged and supported a lot of their regional improvements, including learning from the Wave 1 and 2 implementation. And they've also used some of that investment to develop evidence-based products to support innovation and quality improvement. So there's various digital toolkits and apps being developed, lots of service promotion materials, videos where people tell their story, or got really creative animations to challenge stigma. So there's lots of great work going on there. So in terms of workforce development, just touching on this, working in partnership with Health Education England to support staff within these new services. There's been training funding rolled out, and we've had mention of a competency framework. So for perinatal mental health, a competency framework have been developed for all professionals that might see women in this period. A specialist perinatal psychiatry leadership programme has been delivered for the Royal College of Psychiatrists to really develop the kind of clinical leaders of the future for these services, and also functional mapping of the roles within teams to help support development of these new roles. And just some workforce development work still to come is scoping the current training provision of perinatal mental health across England to develop a directory of training, and also specialist funding further specialist perinatal mental health training for the other professions within those teams. So it started with psychiatrists, and that now will be rolled out to all the other staff groups. So just to talk about some of the other support work on the programme before I finish. So mental health care pathways guidance has been developed with an expert reference group and published this year. Feeding nicely into kind of Tom's talk, we've done a lot. I've done a lot of work actually as the lead on the programme for this in partnership with colleagues in NHS Digital, because actually when we started this programme there was no data available in these national data sets about women in the perinatal period accessing mental health services. So we've been able to work in partnership with NHS Digital to link the maternity and mental health data sets, and we're just starting to get some exciting reports out of there, identifying women accessing different mental health services in this period. So that's up and coming, and we've got some work to do on data quality, but that's really exciting to help us see the impact of the programme and identify the areas where there's more to do. Also, we're looking to develop various best practice guidance to commission organisations to work with us on that, for around implementing outcome measures, guidance about involving the whole family in those services, and also improving the equality of access across different communities, because we know that there's still some areas of the community that find it hard to reach these services when they need them. And we're also looking at currently developing levers and incentives within the contractual system in the NHS to ensure that CCGs continue to invest in high quality perinatal mental health services. That's obviously a real whistle-stop tour, but for further information on any of those products or deliverables, that's our shared team email address, and someone will be able to respond to you there.